Hi, as some of you would have seen, I did a video last week on exercises for sciatic pain. Once you can do these initial exercises pain-free, it is important that we progress to core strengthening exercises to help make the muscle stronger and to have more endurance to prevent from further reoccurrences. In this position, we're going to lie on our back, we're going to have one leg bent and one leg straight. You're going to have your hands either side of your back right here. What we're going to do is we're just going to curl up until you can feel it and then come back down. Same again, so we're going to do one set of 10 of these. If you find these particularly easy, you can lift your elbows off the floor and then curl up like that and come back down. And this is really good for just starting to tense the core in by here, okay? So the next exercise is called the dead bug. Again, we're going to come back into this position. This time we're going to put our hands up in the air and our knees up in the air. We're going to bring your opposite leg and opposite that arm down to touch ground and then come back up. And then we're going to do the opposite arm and opposite leg again. If you find these exercises too easy, you can make them harder by not touching the floor. Again, we do one set of 10 for these. This exercise is for our glutes, which are these muscles by here. It's called a glute bridge. So same again, we're in this position, put our hands down by the side, head on the floor, we're going to put our knees bent and we're just going to push straight up towards the floor, ceiling and then come back down towards the floor. And same again, push up like that and all the way back down. And what we're trying to do here is we're trying to drive our force up using the glute muscles and squeeze your glute as you get to the top and come back down. If you want to make these exercises harder, you can do one leg. So you keep this leg straight like that, and you just bring the one leg straight up and back down. Or if you want to do this leg, same again. So the next exercise is called the quadruped tract or the bird dog. So for this exercise, we come onto our hands and knees. We need to make sure that our hands are below our shoulders like this, and our knees are below our hips. For this exercise, I normally ask patients if they can either use a ball or a ball of socks, and I'll tell you why for that now. So we're going to come into this position, and we're going to bring our arms out 10 times on each arm. If you can do that, we can then put this onto your back, and then we're going to do your legs. We're going to do one leg at a time, and we're going to keep your leg like this. Keep it nice and straight, and then bring it back in. And then we'll do the other leg and back in. Now the reason I put the ball or the socks on here is because some people will under rotate where it'll roll off, or they'll come too high and then it rolls off the other side. Okay. Once you can do the arms and the legs separately, we can then do opposite arm and opposite leg. So again, in this position, you come straight out like that, and then you come back in, and then we do the opposite arm and opposite leg. If you want to make it harder again, you can then come in and do opposite arm and leg, but don't touch the floor. So you come all the way out, and then come in nice and smoothly, touch the knee, and then come back out like that. And then we would do the same on the other side. Come out like that, come in, touch the knee, and come out like that. And that's those exercises. The next exercise is called the side bridge, and we're aiming at working the QL muscle here, okay? We're going to come, for starters, you can keep your knees bent. We're going to come into this position, use this hand to hold onto your shoulder, and you just try and push up like this. Whilst we're working in this position, we're using these muscles. So you start off by doing one set of 10 of doing these. As you find you can do them and you can progress, you then try and hold this for 30 seconds. And as you progress and you're okay with that, you will then keep your legs straight and then come up and hold it for 30 seconds like this. The muscle we're working is this one, trying to hold you up, okay? And that's the side bridge. So as you feel you're able to do these exercises, you can progress them to 2 sets of each exercise after 3 to 4 weeks, and then to 3 sets of each exercise after 6 weeks. It's important that you keep up with these exercises to reduce your chances of low back pain in the future. I would recommend 4 to 5 times per week. Please feel free to like and share. Thanks guys.